Apples, pasta, rice, and bread are just a few different types of carbohydrates that we eat on a daily. But what is so important about carbohydrates? Your body breaks down the carbohydrates you eat into glucose, which is your body's main source of energy. Glucose then enters your bloodstream, which signals your pancreas to release a hormone called insulin. Insulin signals glucose uptake to your muscle, fat and liver cells so they can use it for energy or store it for later use. When glucose enters your cells, the glucose levels in your bloodstream decrease. It signals your pancreas to stop producing insulin, resulting in a negative feedback cycle. In the case of type 1 diabetes, patients typically lack beta pancreatic cells which produce insulin. This results in unregulated blood sugar. While there are many treatments to type 1 diabetes, stem cell therapy may help patients produce their own source of insulin, acting as a potential functional cure. The stem cell transplants are derivative of reprogrammed embryonic stem cell islets. With the addition of further genetic modifications, the stem cell transplants can potentially evade the patient's immune system, removing the need to take immunosuppressants and minimizing the risk of transplant rejections. This treatment is still currently undergoing clinical trials, but there is very promising development. In a trial in 2023 at Peking University, a team of researchers took cells from a woman and reverted them into a pluripotent state to create clusters of insulin-producing islets. The researchers then transplanted roughly 1.5 million of the reprogrammed islets into a woman with type 1 diabetes. 2.5 months after the transplant, the woman was producing enough insulin to regulate and stabilize her blood sugar 98% of the time. To commercialize and hasten the process, other researchers have begun testing the same process using donated embryonic stem cells. Researchers at Vertex started a new trial and injected 12 patients with the islet cells. 3 months later, all of the 12 patients started producing insulin and some did not need insulin injections at all. Thank you for watching and remember to keep up with other pin posts.